Okay, so this is going to be Dr. Elliott's video on taping a shoulder because we want to keep the humeral head into the socket correctly. So a couple of things, you know that your tape that you're using needs to have some stretch to it. It's very important to have the edges of your tape rounded. The tape strips that I'm using right now happen to be already pre-rounded. I just pull them off and they've already been cut. If your tape is not like this and you're cutting tape yourself, you want to make sure after you've cut your strips that you round the edges of the tape. It will make a difference. All right, so what we're going to do is we're going to take our first set of strips and we're going to just tear the back of the tape, and you're going to see it's got a paper back. When we tear that, then you're going to see, if you feel it, it will stretch a little bit. So you want to do one end and then tear the tape, the paper backing a little bit on the other end. We refer to this as the base or the tail. So for this first two strips, you're going to just peel the tail off of one end, and you're going to take that and tape it right at the top of the shoulder here. Okay? And then I'll pick up my little paper backing here. You want to just gently rub the tape onto the skin to make sure that it warms up, it heats up, it activates the tape a little bit more if you get it warmed up so that it stays attached well to the skin. Then what you're going to do is you're going to flip that tape over, pull the rest of the backing off, all right, and just go ahead, hold it at the other end and pull that middle section, because we want a little bit of pull on the tape. So generally what I tell people is pull it till it can't pull anymore and then back off about 20%. So you want 75-ish% pull on the tape. And then once you've got that pull, you want to lay it down onto the arm. Make sure it's not sticking. Bring your arm out just a little bit, just like that. And you're kind of bringing it around just like that, okay? And then I usually take that piece of paper, and again, you're just rubbing it along the skin just to activate, to help it. All right. And in a way, if you can think about it, what we're trying to do is to create two parentheses around this shoulder head. So now you've got that middle part attached. Then for this tail, this last little base, you just pull the tape off and then let the tape lay. There's no stretch to either bases. You lay the first one down, you just plop it on there and make sure it sticks to the skin. There's no stretch to that part. You stretch the middle part about 75%, and then when you get to the last part, you just pull the paper backing, and again, you attach it to the arm, no stretch. All right, so then with her arm, you've got one, and you can kind of see the parentheses. It sort of wraps around and comes in. We're going to do the same thing with the second strip. So we're going to create our little tails here by tearing the paper backing on both ends. Remember, again, the edges are curved. So then we just peel the tape off one tail, and we want to mirror then what we did on the front. So we attach there, and it's okay if the tape crosses over a little on onto the other side. Again, you want to just rub gently. We just want to make sure it gets warmed up a little bit. All right, then we're gonna take the paper backing, which is sometimes difficult, especially when you don't have any nails like me. You just kind of find, there it goes. So then you just pull that backing off, stretch your tape, and then lay it as you go and bring it around just like that. So again, it looks sort of like a parentheses on the arm. Again, you're gently rubbing the tape against the body. It heats it up, helps the adhesion of the tape to get activated. Okay, and then it's all beautiful, just like that. And then again, you pull off this last little bit, and then you just let the tape lie. There is no stretch on that part. Okay, so when you're done with these first two sections, it should look like this. Tape supporting at the top of the shoulder, all the way around on the bicep, and then the tricep, so the front of the arm and the back of the arm, and then it comes around at the bottom, and they meet, okay? Now, this third strip is going to be a little different. You're still going to pull the tape off the back, the paper backing, okay? Only this time we're going to attach differently. This time we're going to pull the middle of the paper backing because we're going to attach this part first. All right. Okay, so we're going to pull the middle off this time. So then you've just got the ends. Okay. And this is the part, this is the tension tape. This is really the important part. All right. And I want you, for whoever you've got doing the tape, feel where the shoulder bone is, and then go like a thumb's width just below that bone, and that's where you want to attach the tape. And you want to attach it so that you attach here at the middle, and you want about 75-80% stretch. So you stretch it, and then you attach here at the middle, and then you want to come up. Because what we're wanting to do is to keep this shoulder in the socket and help provide support for this humeral head to stay in. Now, it's going to look a little funny at this point because I got to tuck this into shirt. There you go. Thank you. So there we go. So then again, you're just same thing as before, you're making it attach well, you're heating it up, and then at the end, you simply pull off the tail and let it lay flat right where it is, no tension. Okay? Beautiful. Then we're going to do the same thing in the back. This was with some tension. And then we pull that final little tail off and then just let it lay. And if you get a crinkle in it, that's okay. Just do your best to work it out. Okay? So just like that. So this is how the shoulder, when it's all done, all three pieces, should look like. This tension tape will start just a thumb or finger widths below that bone that you feel. You want to attach here and then pull with a slight upward tension and attach at both places. This will allow the shoulder to move, so it's not going to restrict any movement, but it will help provide a little extra support for that humeral head to remember its original position and that it needs to stay here. Okay? If you have any questions, don't hesitate to call or reach out to us.